Well, for more on this topic, we are joined now by Dr. Warren Sayre from Summit Medical Group, along with Dr. Stephen Boyce from New Life Center for Bariatric Surgery. We really appreciate the two of you joining us today, and we want to begin by getting both of your reactions, not only to the recommendations, but the screenings that they're suggesting. And we'll start with you, Doctor.
Thank you, and thanks for having us. We had known that these recommendations were available or potentially coming out this summer, so we were kind of excited to see them, but they had kind of come out at a preliminary recommendation this winter, so we're not taken by surprise, but we're excited about the opportunity to actually talk to people about their BMI, about obesity, because it still seems like kind of a taboo issue to talk to about patients when they come into the doctor's office.
Kind of sets the standard, I guess.
I agree. I think it's a great first step in treating obesity as the disease that it is. It's recognized as a disease by the World Health Organization, and it behaves like a disease, and physicians need to be comfortable talking to their patients about it.
Let's talk about that and bringing the subject up. It is somewhat uncomfortable for a doctor to bring up the patient's weight, right? So how do you approach that?
I think often it's uncomfortable to bring it up, but again, like Dr. Boyce said, it's almost like it's a secondary issue that they come in, and most office visits that you have with your primary care physician, they'll check a weight, and when you have a height and weight, you can calculate the body mass index. So most of the time we have that information available to us, but the focus is on other issues, blood pressure, cholesterol, or diabetes. So this gives us an opportunity to say, okay, we're concerned about the weight issue and how that affects these other diseases. So it's a great opportunity to talk about something that, again, is somewhat taboo.
Right. Now, Dr. Boyce, let's talk about that target BMI of 30. Do you think that's a good number when it comes to determining obesity versus being overweight?
I do. I think it's as good as we have. Once you cross that threshold of a BMI of 30 or above, that's where we start to see the development of these other diseases, such as high cholesterol, hypertension, and diabetes. So there does appear to be a distinction once you cross that threshold, and I think it's as good as any that we have.
Yeah, and of course the focus group recommends an intensive weight loss program. How effective are these programs?
You know, I think if you selected patient, they can be quite effective, and they can allow the patient to achieve long-term weight loss and improvement in their health.
Now, Dr. Sayre, obviously you're giving the patient advice. Do you think when it comes to weight that the patient's going to be receptive and open to these weight loss programs?
I think it comes in the approach that you have with the patient, and as Dr. Boyce said, there are tools that we have as physicians that we can ask and find if the person's ready to change, what their best learning styles are, how we can get them into different programs, be it group or individual programs that have that high intensity, high touch, or patients are engaged to make changes and see those changes that they've made, set goals for themselves, which is really the key to change, is them setting those goals and achieving those goals.
Yeah.
So our goal as a physician is to help them set those goals in an achievable way and coach them and support them in making those goals.
If they don't reach that goal, how do you decide when to approach surgery or when to start medication?
Well, certainly if a patient is obese and is developing other illnesses directly related to that, the first thing you'd probably want to try is medications, pharmacotherapy. However, if they fail that, or if they are in what's called severe obesity, which is more obesity than being in the obese category, that is BMIs of 35 and above, then those would be patients that you may want to consider a surgical option.
Okay. Well, thank you both for being here, Dr. Sayre and Dr. Boyce. We appreciate your expertise and your opinions today. Thank you.
Thank you.